Hey, what's up everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and we're going to do some more A&P today. Specifically, we're going to check out a group of muscles known as the medial thigh muscles. Some people call them the adds or the adductors, and some of the hip flexors. So let's check them out. All right, let's kick off this talk with a little bit of line kicking by the Rockettes. Of course, the action they're doing here is flexing the thigh. And you can also use your thigh flexors to, say, do some Muay Thai fighting and throw a knee like these two fellows are doing to each other in a sporting event. We'll also check out some of the adductors of the legs against adduction, ADD, referring to bringing the thighs back to the midline here. Now, she's doing some adduction, but only when we come in home like this. And of course, she's doing some adduction as well, but fighting gravity to get the same results. So let's check out some of these thigh flexors and thigh adductors. So when you get to thigh flexors, pretty much what you're talking about is these two guys right here. And it's actually arguably three, but only two of them are considered to be hip flexors. So ILIOPSOAS is usually how you hear that pronounced, although I have heard professionals say ILIOPSOAS where they hit that P hard. I'm guessing it's potato. Sometimes this is referred to the tenderloin muscle. It's two muscles put into one, and one of them is called iliacus, and it's the little kind of a half a heart shaped muscle that's right here. I'm circling on the left side of the screen. And on the right side, you see the skeleton rotating. That is iliacus there. Notice how it starts anteriorly in that superior iliac fossa and kind of bends around the front of the femur, like right under its neck, and then plugs in or inserts in the lesser trochanter of the femur. And of course, this would be a perfect position of a muscle to do some hip flexion. So flex the femur, laterally rotate it, innervated by the femoral nerve. Its partner here is psoas major. Now, there is a psoas minor, but it's not considered part of the iliopsoas group. To go to the left of the screen, psoas major is right here. And on the right of the screen, I can pull up an image like this. Similar position, but this one, of course, originates along the vertebral column from T12 to L4. It will still reach down the pelvis underneath and grab onto the lesser trochanter. And of course, its only action would be to flex the hip. And then it will be innervated by lumbar nerves, L1 to L3, not the femoral nerve. Now, as far as the adductors go, we can start with PECTINEUS. Now, on the left-hand side, I'll show it here. Try to outline it tightly there. There's PECTINEUS. Originates on the pubic bone, which is right here. And then, of course, we'll go and attach to the femur. Now, it's not a specific location. It's usually just stated as the diaphysis of the femur, but it's really proximal part of the diaphysis of the femur, right underneath the head of the femur. Flexion and adduction of the thigh is what it does as an action, and is innervated by femoral. Sometimes you do see some additional innervation by the obturator nerve. Now, gracilis is on the other side of the screen, this green muscle, this most medial of the thigh muscles. Look how long and slender it is. It's very gracile, right? That's where it gets its name from, a long and slender muscle called gracilis. Now, the key here is not that it originates in the pubic ramus, which it does. The key here for identifying gracilis is that it inserts in the tibia. So notice how it goes all the way down to the pes anserinus, even though the pes anserinus is not shown. If you're having trouble with pes anserinus, go back and check out the hamstring videos, and I explain it better there. You look right here, I'm drawing an arrow now. This kind of looks like gracilis to a lot of students when they first see it, but notice it's not attaching all the way down on the tibia. That's attaching on the femur, so that's going to be one of the adductor muscles we'll see on the next slide. Actions are adduction, rotation, flexion of the thigh, and it is innervated by the obturator nerve. As far as the triplet of adductors go, they look quite messy on almost every image you find. It's hard to find really nice images here because they're all covering each other up and kind of sprawling behind another one. So let's start with adductor brevis, the short one. Now I'm going to go ahead and outline it. It's often covered by pectineus, and if I put an arrow here kind of pointing, there's pectineus has been cut. You can see the other cut way up there on the pubic bone, but pectineus has been removed. So is ILIOPSOAS for that matter, because it covers up these structures. So there's adductor brevis, right? Brevis, the short one, the brief one. Inferior pubic ramus to the lesser trochanter and some of the line that runs down the femur, that linea aspera. Adduction of thigh, of course, the name gives it away. There's not much more you can do in that position anyhow, except adduct the thigh. Obturator nerve is what serves it with power. Adductor longus is the one next to it, and I'll just put an L here on top of it. It's very obvious in most of the pictures immediately. Similar origin, similar insertion, similar action, similar innervation. Adductor magnus, the big one. So some of magnus is here. I'll put an M on it in yellow. And then some of magnus is here, and some of magnus is here. All of that is adductor magnus, and it's kind of sprawling out behind, well, both adductor brevis, adductor longus, pectineus, everybody else. So called adductor magnus because it's the biggest one. It's going to have multiple origins. Yes, it will originate in the pubic bone, just like the other two adductors, but this also has a portion that originates from the ischial tuberosity, and I'll circle it here where they have this O drawn on the figure. That's adductor magnus is originating there. Similar insertion, linea aspera, and right down here is where we would find the adductor tubercle. Again, don't confuse that with the gracilis. Gracilis would wrap all the way around the knee and insert pes anserinus of the tibia. Adduction flexion of thigh, innervated similarly obturator, but also the sciatic nerve plays a role in innervating this very large adductor magnus muscle. All right, hope you enjoyed that one. Thanks for watching to the end if you did. Check out some more videos in the series, learn some more about A&P. See you for the next one. Bye-bye.